Hi, my name is Punam Hills and I'm a physical therapist at Body One Physical Therapy in Zionsville. I specialize in jaw pain and I wanted to talk to you a little bit today about what to expect with your first appointment. So our front office will send you the appropriate paperwork and you will come in with that paperwork filled out. At your appointment time, our aide will take you back and take your height, weight, and blood pressure. After your therapist has reviewed your paperwork and your medical history, they will come in to talk with you about your pain and any kind of dysfunction that you're having. So we'll talk about when it started, what makes it better, what makes it worse, and after we have a good idea of what's going on, we'll do a thorough evaluation of your neck and jaw.
After getting a good picture of your symptoms, your therapist will do a thorough physical exam. You'll start in a seated position while your PT performs a screening of your cervical range of motion. While doing this screening, we will see if anything makes your pain better or worse and to see if you have any dysfunction along your neck. Then I will look at the quality of your motion with opening and closing to see if you have a deviation or deflection or to see if anything reproduces your pain. Finally, I will measure your opening to see where your baseline is. Next, you will lay on your back while your therapist assesses the muscles of your neck for tenderness or tightness. They will also assess the mobility of your neck, which is important because your jaw sits on your upper cervical spine. Any dysfunction through your cervical spine can contribute to jaw dysfunction. Next, your jaw will be assessed extraorally for any patterns of dysfunction or popping. Finally, if your pain and motion allow, we'll do an intraoral assessment of the muscles of mastication and joint mobility. Your therapist here is assessing for any tightness, pain, or trigger points.
After doing a thorough evaluation, your therapist will talk to you about what they found and an appropriate treatment plan for you. We'll talk about how often you need to come into physical therapy and give you some exercises to start at home. We'll also discuss daily habits that might be in your best interest to avoid and some things that may help on a daily basis with your pain level.